Namaskar and a very warm welcome to the 17th edition of the phone-in program. I'm Nidhi Kumar and you're watching India Science. Well, India's second wave, friends, is now a matter of global concern. And the reason is the numbers are 3,49,644 cases that are new cases yesterday. The actual figures could be much higher. But India's recoveries are holding through. More than 14 million people have recovered so far. That's good news. That 82% of all the cases. The cumulative number of COVID-19 vaccine doses administered today has crossed 15.68 crores. In this phone-in program, where you can ask your questions and we take your queries live, today we are joined by Dr. PRAVESH MEHRA, Director, Professor Oral Maxillofacial Surgery at Lady Hardinge Medical College, Delhi. Namaste, Dr. PRAVESH MEHRA ji, and welcome to India Science. Many thanks for joining us today. So, as you know that the citizens who've tried to register now for the vaccination for the 18 plus are facing a lot of teething troubles. The website is not opening and they're not managing to get the appointments. What would you like to say to such people who are waiting in line for the vaccination, sir?
Yeah, actually, everyone is anxious to get the vaccination now, especially our 18 plus age group. And it's essential that each one of them, it's only a matter of time I would get it. Just be at home, be safe for a few days, utilize to that, because we are getting too much of load onto our app, which is resisting yourself for the vaccination. So just a few days, and I think the app will get running, and then you can get the vaccination on your planned date and time.
Absolutely, as you rightly said that there is a lot of load on the website which has been overloaded. So, important questions, you will be able to get that vaccine and you must take the jab as soon as you get your name there. So, the virus is airborne according to Lancet study, which reiterates that this is a long jump virus, which means sometimes it skips rooms also. And you know, you may be in closed spaces, it may not attack you in the same space, but it may sometimes skip rooms. How do India's protocols change with the second surge? Would you like to elaborate on that?
Yeah, the virus we knew always that was an aerosol generated one. It was initially thought to be a droplet infection, but if you are in a closed room where there is no ventilation and there is no room exchange or room air getting exchanged for a minimum of 6 to 10 cycles in an hour, then there were chances that you could get infected if a person who was positive had visited the room and had removed his mask.
Absolutely. We have a caller now.
Yeah.
Sir, we have a caller now, Rohini from Bangalore. Namaste, Rohini ji. Welcome to India Science. Please ask your question. Doctors here to answer it.
Thank you, ma'am. Hello, sir. I understand the virus is mutating, but are there any new symptoms that we need to watch out for in the second surge?
The virus, as we all know, any virus mutates in a few years, days, minutes, or hours, or months. Right? The virus had initially last year has certainly decreased. Okay, the infectivity has come in this virus, which has come in the new wave. But we need to be careful regarding it. It's very infective, and the signs and symptoms remain the same. It is not much of a difference. You would start with a lethargic thing, some malaise, some fever, some sore throat in the eyes, or a diarrhea. So you should not miss any sign and symptom, loss of smell or a taste. If you feel anything, immediately call up your doctor or get back to your medical professional and be on observation. Get a testing of an RT-PCR done if you are symptomatic as soon as possible.
Absolutely, sir. India sets a daily world record of new infections now as far as COVID-19 is concerned. And we are saying there is pandemic is out of control nearly in India. We're also talking of the various variants like the Sri Lankan variant. How did we get here? Have there been systemic lapses? What should we do to get the situation right is my question to you, sir.
Okay, we can't fight the virus with just one arm. Okay, there is no drug for the virus. Like a bacterial infection, you got antibiotics. For a while, we still don't have any antiviral therapy, which is useful. We can only decrease the viral load, but we cannot eliminate the viral load. The body immunity has to respond to this virus. Okay, so we have to be very careful to prevent the infection from entering our body. Number one thing, and there are three things that we need to do. We need to maintain social distancing, 2 gaj ki duri, there is no doubt about it. We need to follow the COVID protocols of cleaning our hands either with soap and water or with some sanitizers as we put out areas, unless it's very essential to visit outside. So we have to give some time for our immunity to respond to this virus. At the same time, we have to keep ourselves healthy because that is the only way to boost our immunity. Whether we exercises, whether we proper diet, whether we properly mental frame of mind. So we need to be positive regarding this. Then and then only we can defeat this virus. And recently, with the vaccination coming in, that's an added weapon in our hands to kill to prevent infection, the virus among the population. So we need to be vaccinated. We need our neighbors, family members, everyone else to be vaccinated to defeat this virus, and ultimately then and done we will win. We will win.
Absolutely. Like you said, we all need to get vaccinated so that the criticality and the fatality of the virus does not affect us. So go take that jab. Meanwhile, we're joined by a caller, Hari from Lucknow. Namaste, Hari. Please ask your question.
Initially, there was this vaccine hesitancy. But when people wanted this vaccine, there is no vaccine. What went wrong?
I didn't get the question. What he said?
He's saying initially there was vaccine hesitancy, but now that people are wanting vaccine, according to him, there is no vaccine, which is totally wrong. The vaccine is there and you will get it. Have you applied, Hari, have you applied for the vaccine? Which hospital have you applied for? We'll send out a message for you. Let us know. Hari ji?
No, but that is a normal human behavior.
Yes.
It is any change, if there's any change in a lifestyle or in any matter, it is not easy for us to take that at once. We require some time to adapt to that change. And that is why initial hesitancy was there.
But now, do you think enough vaccines are available, doctor? Because we have Sputnik also. Moderna has also been given clearance by the Indian government. There is no shortage of vaccine as such. There are several vaccines. You're getting a choice of vaccines. And do you think there is any crisis of vaccines as the caller is pointing out? Would you like to elaborate on that?
Yeah, I don't think so because that's a government matter to take a policy. Normally, what was the plan of the government was, all over globally it was there the same way, that initially the healthcare workers, then the people who are more chances of getting comorbid state population by 18 plus. So still the pediatric age is left out because that requires some clinical trials before we get into the pediatric age group. It is not easy to give it to a pediatric age group because they are the vulnerable population there also.
Yes, doctor, we're joined by another caller. Thank you, Hari, for joining us. Meanwhile, we have Arya from Delhi. Namaste, Arya ji. पूछिए अपना सवाल. Please ask your question. Welcome to India Science.
Hello.
Namaste, Arya ji.
Yeah, namaste. Namaste, sir. So my question is the virulence worse in the new variants, and should we expect more mutant variants?
As I said in my previous thing also, any virus mutates, any virus, in a minutes or hours or months or years, it will always mutate. But the lethality, normally what I've seen over time is when the virus mutates, the lethality comes down. It does not rise again. Okay, so that is one good point of it. The virus dies down itself. But yes, coronavirus has been there since 2003, 2002 when we had the MERS, the SARS, and this is the new form of that two virus that is the coronavirus. So you might have a new virus also coming in a few years. That is not a big thing. It could be there. So we have to be stationed out to get a new virus. We have to be stationed out to treat or prevent the strains of the viruses coming in, which the virus mutates out. So the basic thing is the only thing is prevention. There is no other thing besides that, and vaccination whenever your time comes to get that vaccination for that virus.
Doctor, we have a question on YouTube. I'll just take that with you. How promising is Sputnik V? What is the, veracity and efficacy of this vaccine?
Okay. So, you see, it is immaterial whether the vaccine is 50% or 90% effective. Because effective means that it is in a controlled population. When the trial was going around, in a controlled population, okay, not in the normal human beings in the community that is there. That would be more of effectiveness. So efficacy is in a control where a trial is going around. So when 50%, 90% is immaterial, any vaccination we should, because all these trials what they have shown us around the world is that if you are vaccinated, then the chances of getting into an ICU or getting a infection which will lead to loss of life is much less compared to not getting vaccinated. So that is the biggest advantage of a vaccination.
Absolutely. We're joined by another caller now, Rashi from Nagpur. Namaste, Rashi ji. Welcome to India Science. Please ask your question.
Hello.
Yes.
Namaste, sir. Namaste, ma'am. So I just wanted to know the kind of spike we are seeing in corona cases, the kind of situation we all are facing. Is there any kind of indication of a third wave? Because as common person, we all are very scared now.
I didn't get your question, ma'am. What did you say?
Sir, I just want to know the kind of situation that we all are facing right now. Is there any kind of indication of a third wave?
Of a further peak or a raise? She's asking, is there any kind of indication that the cases would further go up? She's saying, I'm fearful, I'm scared.
You see, the cases, as I said initially only, that the incubation piece of virus is around 2 days to 14 days. Okay? So the number of infective cases are going to rise during the 7 days time. Okay? But what you need to do is get yourself tested as soon as possible, so you know that where you are. And this virus, only that first 5 days, you just have small symptoms. You just have fever or a slight cough or say a body ache, where the best drug is a paracetamol, 650 milligram. Take that. But if you are tested, then you know, and for sure that you are in a day which is vital. When the oxygen saturation or other problems comes in, okay, so this time you will be prepared for that during that 5th and the 10th day. If there are any problems happening, your healthcare provider and you would be prepared to face these consequences. That is so you need to get your tested as soon as possible, and there is no way.
Doctor, another question that is coming on the YouTube is about oxygen plants. How do you think that the oxygen facilities could be better increased and there could be more ICU beds available? As a doctor, what is your take is what our viewers want to know from you today.
Actually, what has happened is, you see, we were adequate in oxygen till last year, till this year, February, till March, April, we were adequate. But suddenly with the rise in cases and the fear coming in among the population, that load has come into healthcare system. And people are just shifting down, and they don't do initially. As I said, initially if you get your tested the first day of the symptom and you know you are positive, then you take all precautions so that your oxygen saturation does not come down. You keep in touch with your healthcare provider and who will tell you what all to do so that you don't face this problem during the 5th and the 10th day. But normally the people don't do that. Till the first 4 days they don't get tested. They take some random medicine. When oxygen saturation starts dipping down, then the fear and the apprehension and the stress comes in. as everybody starts rushing to the healthcare services. So we are then at a problem because we can't admit each and every one of the person there. And our systems collapses. So what is required now with the number of surgeons of cases, the government has opened up. We've had donations from foreign countries coming in.
Yes, absolutely. Meanwhile, we have another caller, Dr. Ananya from Kochi. Namaste, Ananya. Please ask your question. Welcome to India Science. Please ask your question, Ananya.
Thank you. Doctor, my question to you is that why are people in the 30 to 45 age group being infected in such large numbers? What should they be doing?
Why are they?
She's asking, doctor, why are the people from 30 to 45 age group being impacted the most? Actually, it is 26 to 45. Yes.
Yeah. So normally, this is the age group where you have some underlying comorbidities. Like you could have some hypertension, you could be diabetic, you could be asthmatic, and you are unknown for it. Okay. This is the age group. So that is why it is essential that each one of us should diagnose ourselves immediately, isolate ourselves at homes, and get ourselves RT-PCR tested immediately the first day we get a sign or a symptom.
Right. But doctor, another question that comes to my mind is that if we look at India's vaccination drive, considering our population, vis-a-vis our population, then not even 10% has been vaccinated so far. How do you think we could possibly raise these numbers? What should be done, according to you, as a doctor?
Yeah. So we are at a phase where we, as you rightly said, we are around 15 crores or 16 crores of the population has got vaccinated.
Right.
And all healthcare providers have been vaccinated. Quite a majority of people above the age of 45 years have been vaccinated.
All Army, Navy, Air Force officers, cadets, everybody has been vaccinated. This is on record. Wonderful thing done by the Ministry of Defense.
Yeah.
They're all done. But yet we have billions. How do we, amplify this? We need to be more aggressive.
Yes, we need to be more excessive. We need to be more, the awareness will come into the population so that they come out in large numbers and get themselves vaccinated. And then the vaccine has to be available at that area. So now the government has given the Sputnik also, Sputnik 5. So they are going to manufacture. The government has increased the manufacturing capacity of both the Covaxin and the Covishield so that they have the thing regarding the manufacturing part. So once that comes in a major way, I think the vaccination numbers, the total vaccinated numbers would increase in the days to come.
Yes. Meanwhile, we're joined by another caller, doctor. We're joined by HB Singh of HB Sharma from Ghaziabad. Namaste. Please ask your question to the doctor. How are you?
Madam, my question is, what should I do if I have any lungs infection? Should I use an oxygen concentrator or a cylinder?
Sir, if you have some lung infection, you have to prevent yourself. Do not go out in the community at present because this virus is very infective. You need to maintain the COVID protocol strictly for your safety and your family members. And if by chance you get it on the first day, you need to get yourself RT-PCR tested and then take all the precautions, get in touch with the healthcare providers, let them decide whether you would require an oxygen concentrator or an oxygen cylinder or some other type of therapy. Let them decide. Do not get into it.
Meanwhile, I'd like to add something to your answer, and also maybe he would need a CT scan. How do you even know your lungs are infected? Are you coughing or something like that? People have started becoming they're just picking up medicines over the shelves now. They've started becoming doctors themselves. I mean, I fail to understand, without a CT scan, how does he know his lungs are infected? Unless he's coughing or he's having those bouts of coughing, for which a mere antibiotic would do. We've been asked another YouTube question about the vaccination drive. By when would, in your estimate, by when would this drive actually be completed if we go by the numbers that are going in today, considering India's population? Sir.
So we are 103 billion population, I
Yes.
think 103 crores. So it would take quite a bit of time. But I think the government is trying to increase the infrastructure, get in more amount of vaccinations, get people more aware regarding these vaccinations. And I think by the end of this year or next year middle, I think we should get near to the target of roughly around 80 to 90% of the population getting vaccinated.
Absolutely. So could you tell us something about aerosol transmission? Why is it more common than droplet transmission? Are we in a community spread stage 3 now?
Yeah, so this strain that is there, it's really infective. If you tend to see your neighbors also or stay where you are, if one of the family members in the flats or in the house gets infected, then automatically in a few days' time, all the other family members in that house are getting infected. It is only because the virus has gone into the air. It is more into the aerosol generation wherever it is there in that room, and any person enters that room without wearing a mask, there are much higher chances that you would get that virus in.
Meanwhile, we are joined by another caller, Leena from Lucknow, from Gwalior. Namaste, Leena. Welcome to India Science. Please ask your question, Leena.
Namaste, Nidhi ji. Namaste, sir. So my question is, an acquaintance of mine, his father had turned COVID positive, but his oxygen level was good, his everything, all the symptoms were okay, but suddenly he had that heart attack and he passed away. And then I heard of similar case with someone else also. In such a scenario, what should one do? How should one be prepared? Is there some way of knowing that this could happen?
You see, any person who's old and whose comorbid conditions are there, you need to be more careful regarding him with this new strain. As I said, this new strain is very effective. So you need to isolate him inside his room. Whoever goes there should make the total COVID protocol before you see him, and always get in touch with the healthcare provider, either by telemedicine or by other means.
Yes, sir. Yes, sir. Now that telemedicine and online consultation is almost provided by every hospital in India. All doctors are answering calls and queries, and you must reach out to them. We're joined by another caller.
Lady Harding Medical College, I would like to remind your viewers that Lady Harding Medical College has taken a lead role in opening telemedicine lines of all its specialties from Monday till Saturday, from 9 to 4, from Monday to Friday, and Saturday 9 to 12 a.m. So we have telemedicine for all departments, which people can go around to Lady Harding Medical College website, and any mode, whether it be landline, whether it be a mobile phone, a SMS, a WhatsApp call, or email, or a video call, all numbers are there. They can get in contact with us, and also through e-Sanjeevani OPD, where you could have a teleconsultation face-to-face with doctors.
Absolutely. Doctor, we have another YouTube question from Ashish who's joining us. He's asking, is there any shortage of the raw materials to produce vaccine? I wonder if doctor can answer this, but anyway, I'll pass your question to you. Sir, if would you like to amplify on this?
Yeah, you see, this is always a demand and supply gap. When the demand of the vaccination increases, then the supply increases. The raw materials have to increase.
Another question that Ashish is asking is that can a single dose of Covishield vaccine give the protection that we need, or a double dose is needed, doctor?
Yeah, that's it. Have a double dose. Fine. So whether you are on the Covishield or the one, you will require the second dose, because with the first dose only, your chances are basically not more than 50%.
Sir.
Because the first dose is a sensitization for your immune cells to the antigen or the COVID antigen.
Right.
The second becomes a booster dose where bodies get a boost and the proper immunity. Let us see, which will last 2 weeks, 6 weeks, till around 1 year, 1 year or so.
Absolutely. And it is important to take both the doses also, because the antibodies will form after your second dose, after 10 to 14 days of you having taken the second dose, if I'm not wrong. We're joined by Akash. Sir.
Always take the second dose of co-vaccine. Do not change the vaccine.
Absolutely.
Don't go for Covishield in the second dose.
Right.
That's what.
We're again joined by another caller. Akash is joining us from Noida. Yes, Akash. Namaste. Welcome to India Science. Please ask your question, Akash.
Namaste, ma'am. Namaste, sir. My question is, what is your take on the vaccine pricing controversy?
Sorry,
What
can you
controversy?
repeat this?
Vaccine?
What is your take on the vaccine pricing controversy?
Vaccine pricing.
Yeah.
You see, everybody wants it free. Nobody wants to pay something for it. But yes, if you look at the company's stake, I think they are not an NGO. They require something for finances. They're going to pay their salaries. They're going to pay for their stocks. So this is a government call to take what to price. But yes, for a general population, it should be free. It shouldn't be priced at a higher level.
Another question on our YouTube is whether lupus patients can take the vaccine. LUPUS. We just got that question, sir.
I didn't get you. NUPS?
Any person suffering from cancer or lupus
Yes.
can.
You see, whether he has cancer or he's undergoing treatment for cancer, they are the people who should initially take it, because they have comorbid states. A diabetic patient, a heart patient, they all should, asthmatic patient, they have to take the vaccination. Otherwise, there would be problems if they have the COVID infection.
Doctor, another query is that if a person has already detected RT-PCR positive, if the test is positive for COVID-19, then how long should that person wait to take the dose, second or first, depending on whenever the test is confirmed? Can the person go?
Once the RT-PCR dose has been, the test has been confirmed and you're COVID positive, so automatically your body would make antibodies to this infection. So you don't need to take the vaccination for at least a period of 1 to 1.5 months till you are fine. Ask your, because whenever you go for a vaccination registration, they will ask you, before they ask you, they will not give you the vaccine. So you have to tell you got the COVID RT-PCR, when it was positive, what all comorbid state you have. The only contraindication or an absolute contraindication for this vaccine is if you are pregnant or if you are suffering with any bleeding disorders. If you have these two things, the vaccination is contraindicated till now.
Okay, sir. Meanwhile, we're joined by another caller, Sumita from Mumbai. Yes, Sumita, welcome to India Science. Please ask your question.
Thank you, ma'am. Sir, my question is, many public health experts were of the opinion last year itself that the first wave exposed the deficiency in India's public health care system. Now, with the second wave, it has collapsed completely. So my question is, where do we go from here? How do we, go forward?
You see, we have to learn from all our mistakes that have happened. What has happened is the second wave has caused more of a fear among the population than anything, which is resulting in the healthcare system into a state where we will stay under stress. So I think the more the vaccinations people take care about these vaccines, then only then less amount of hospitalization would be required. So answer to this, your question is basically we have to increase our vaccination drive so that people are getting safer and they have to maintain the. What has happened is people attitude changed when or they saw the first wave go away, they thought the second wave would not come. So they thought the COVID appropriate behavior is no sense now. Let us go and party around. Let us go and mix around, which is not advisable at this time. For at least for a year or so, we have to be careful. Maintain our COVID behavior that we should and get ourselves vaccinated when our turn.
I think vaccination is the only answer, and avoiding super spreader events. In fact, staying away from all kind of company, and even at home maintaining the protocol, because this virus is deadly. And remember, this virus is more smart than any of us. And in the end, I'd like to thank Dr. Mehra for joining us today and sparing his valuable time on the 17th edition of the phone in. Thank you so much, Dr. Saab. And transmission must be stopped. Spreading must be stopped. Improved ventilation is the key, and Indians are now anyway used to hand washing and COVID etiquette. It is time to move towards singularly focused, undiluted vaccination and proper masking. And on that note, this is a wrap on this edition of COVID Phone In. Namaste, and let's all take the jab. Namaskar.
हेलो थैंक यू दीदी मैम को थैंक यू बोल दियो